Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. This is a webinar where we talk about Lyme disease, and you create the webinar with your questions. No 2 weeks are ever quite the same, although sometimes we can get into themes based on your questions, and because a lot of these are all created independent of each other, it's interesting when we get into theme night. So if you're wondering how you can write a question to me and you haven't participated here before, over here on the right-hand side of the screen, down at the bottom, is a chat box. And in that chat box, you can write your question. I ask that you try to keep it on the shorter side, because if it gets too long, it becomes too long for me to post. If I try to post really long questions, it ties up my computer screen, and then I have to stop the webinar. Literally, I've had to do that a couple times, okay? I'm going to try to answer your questions to the best of my ability. Sometimes I get stumped, and sometimes you guys give me some new ideas and things to think about in terms of how I approach things in my practice and how I work. So I look forward to see what you have in store for me tonight. We'll do this webinar. I plan on doing it for an hour and a half. Sometimes I tire out a little bit because remember, I'm doing this at the end of my day, but after I've already done some patient cares, but I'm intending on doing this for an hour and a half tonight. I am creating a recording of the webinar, so you'll be able to go back and hear again. The recording is something you can listen to, but feel free to share it as well, too. If you think you get some help tonight and you want to share that information, feel free to do that. You can look for an email from me coming to your email tomorrow morning somewhere before 9 to 9:30 a.m. Pacific Standard Time here in Seattle. That's when I try to get it out. Often I even get it out before then, but for sure, I try to get it out by 9:30 a.m. in the morning. And in that email, I'll have links on where you can see the recording of the webinar. I also will have the sign up for the next webinar, okay? Now, this is my last webinar for this month. I'm sorry, actually, till the end of the month. So I've already done 4 webinars in a row. This is my 4th in a row without a break. And next weekend, I'm going to take a break. But the week after that, I will be back. And I believe that's on the 30th. And in tomorrow's email to you, there will be a link that you can sign up for the webinar, okay? Now, if you happen to not get the email, the way that you can find my recordings, there's a few places. Number one, you can find it on the homepage of my clinic website, which is martyrossmd.com, or you can find it on the front page towards the bottom at my supplement store, which is Marty Ross MD Supplements at treatlyme.com, or you can find it, of course, on the webinars page at my Lyme disease information site, which is Treat Lyme by Marty Ross MD, and you can find that at treatlyme.net. Okay. All right. So there's plenty of places to go ahead and find it. So I think I've covered most of the business stuff here. Let's go ahead and get started. Oh, while I'm doing the webinar tonight, I will be reading your questions out loud, but I'm also going to present them on the screen. So if you're in the live version of the webinar, you actually get to read the questions yourself. If you, however, are listening to a recorded version, you're going to have to listen to me read it because the questions I present in the live version do not show up in the recorded version. Okay? All right. All right. Hello, Bill. Let's see. Hello, Dr. Ross. On one of your recent webinars, you commented that the glucosamine from Costco was garbage. Do you have any information or studies to validate that? I was using a very expensive glucosamine and switched to Costco a year ago, and subjectively, I'm still getting a similar response in the reduction of joint pain and inflammation. Thank you. All right. So, Bill, it's a great question. So let me tell you what I meant by that. So what I meant by that is there's a lot of garbage products out there. And if you're going to try to see if glucosamine or any supplement for that matter is going to work for you, I recommend using what are thought to be high quality brands. And if it does seem like it's working with you and you want to switch over to buying supplements like at a Costco or even like at your pharmacy, then go ahead and do that. The supplements that I've chosen at Marty Ross MD Supplements are ones that I have found to be helpful based on a review of information from those companies and some proof of what they say is in those supplements is in it, okay? Also, There are supplements that I have chosen to work with based on what I have found to be positive benefit in my practice as well too. Okay. Now, to my point, I want to just show you something about, I'm going to do a screen share so you can take a look at the studies that suggest that a lot of supplements that are out there are garbage. And I'm just going to show you where you can look at it so you can review the study yourself. The study did not show specifically Costco, but I'm kind of throwing Costco in a generic grouping of companies that use lower cost supplements, and it's usually the lower cost supplements that you're going to run into trouble with. Okay. All right. So let me just do a quick screen share here. All right. So I'm going to go over. So this is my supplement store, Marty Ross MD Supplements. Okay. If you're wondering what products I have researched and scoped out to make sure that what they say is in the product actually goes in, and that they've done a good job of selecting products or ingredients that have the greatest chances of working, so high quality ingredients, take a look here. And anyone can buy here, but if you want to know what I call high quality products based on my review and my use, take a look here, okay? So you can take a look at the supplements, and then you can see over here by the different manufacturers that I hold in high regard based on my review, okay? Then, to my point, take a look at this, my story, where I talk about why I set up a supplement store. And one of the things that I raise in here, you'll have to read it kind of down here in the middle. Where is it? Oh, here we are. So in this section called Quality Matters, I talk about some research that has been done. So for instance, the New York State Attorney General documented that there are problems with supplements. In 2015, he studied supplements at Target, Walmart, GNC, and Walgreens, okay? And these are companies that are similar to Costco, okay? That's why I kind of said Costco too. And what his study showed is that the active ingredients listed on the label and the products were only there 21% of the time by DNA testing, okay? And that in addition, 35% of the ingredients that this company found by testing were not even on the product labels. Okay, so there's a lot of garbage out there, even at so-called good stores like Walmart and Target. Okay, and if you want to see more, if you want to see the references for some articles that document that, take a look down here at the bottom. Okay, all right. So my point is that there's just a lot of companies are just not putting in what is supposed to be in there, nor are, and sometimes they're putting extra ingredients into, and I've tried to take the guesswork out of you at my store by basically having, researching and looking at this myself and picking supplements that do have what they say is in the product, and that do a good job of picking high quality ingredients basically. And also, these are supplements I use in my practice that I have actually found to have good benefit. Okay. All right. So if you find that product from Costco is working, great. It isn't where I would suggest somebody starts when they're trying to figure out if something's going to work. If you're trying to figure out if something's going to work, you want to go with the highest quality and the best chances something's going to work first, and then step out from there and see if lower cost products actually will continue to work for you. Okay? All right. Thanks for the question, Bill. Oh, one thing I think I said is, that my product store, my supplement store is what I use on my patients, okay? But anyone can buy there. So you can use it to look and see what do I recommend, but it's also a place you can go ahead and buy supplements as well too. Okay. All right. Let's see here. Hello, Sita. Let's see. Hi, Dr. Ross. Is Pure Encapsulations a company that puts its supplements what it claims? I was looking for hyaluronic acid for my unhappy joints. Do you recommend Pure Encapsulations hyaluronic acid? Is there a database for checking which supplement companies are reliable? Would you say hyaluronic acid and glucosamine sulfate are good starters for arthritic type issues? So first of all, to answer your question, I consider Pure Encapsulations to be a high quality company. In fact, I carry a number of products, of their products at my supplement store. Okay. All right. Now, however, having said that, I don't find hyaluronic acid, everyone, is a substance that is used to build tendons and ligaments. Okay. So tendons being what attaches muscles to bones, and ligaments being what attaches one bone to another bone at a joint. Okay. All right. When somebody has a lot of arthritic joint pain, it usually is not the tendons and ligaments that are the problem. But the problem often is that there is a wearing down or a destruction of the cartilage in the joints. Okay, so because and that's what creates the problem. So in a normal joint where you have two bones come together in a joint, those surfaces of those bones are covered in cartilage. All right. And cartilage is smooth, so it allows the bones to glide over easily. And cartilage is a lot softer than the bone it covers, which acts like a shock absorber then, okay? But because it's softer than the bone it covers, it can wear down. And in Lyme disease, what can happen is the Lyme germ likes to burrow into tissues. And the way it likes to burrow into tissues is it releases enzymes that can destroy tissues, like it can break down cartilage. And so then you start getting, when the cartilage wears down, you wind up getting bone rubbing on bone. That leads to inflammation, which leads to pain. Okay, so the best thing I have found when you've got a lot of joint pain to rebuild the cartilage is to use glucosamine sulfate, 500 milligrams 3 times a day. I like a Thorne product for that. Okay, the other thing to do if you've got a joint pain is try to get the inflammation down too. And what I like using to get inflammation down in Lyme disease is to decrease inflammation chemicals called cytokines that are overproduced by the immune system when you have Lyme. And what is useful to do that is to be on a component of turmeric, which is called curcumin. And the product I like using for that is something called Beriva 500 by Thorne. And that's a 500 milligram pill, and you would take that 3 times a day. Okay. Now, if you're trying to see if glucosamine is going to work, you want to give it a minimum of at least 3 months. And it does help about 80 to 85% of the time, based on what my experience tells me. Okay. All right. But you've got to give it time. And again, as I was mentioning in the first question tonight, use a high quality product. So I like the Thorne product for that. Okay. All right. Thanks for that question. Hello, Michelle. Let's see. Hi, doctor. I've asked multiple questions before, but the other night I had a panic attack in the middle of the night and felt extremely hot. I have POTS and clinically being treated for Lyme. I've had this before, but I'm so anxious about it happening again. Let me see if there's another part to your question here. Michelle, I'm not finding another direct part to that question. So let me just make a comment. So I'm not sure what your specific question is. The one thing I would say about panic attacks is that panic attacks happen sometimes. Okay, they can be an outgrowth of having ongoing anxiety, but we also tend to see them in one of the Lyme co-infections, which is called Babesia. All right. So you may want to make sure that you're not having Babesia. Babesia can be under POTS as well too. Lyme can be under POTS, can be a cause of POTS as well too. So the thing I would do is make sure you don't have Babesia. It's just as kind of a common information point I'd give you here. And in terms of thinking about whether you might have Babesia, you can test for it, but we're only good about testing for maybe 2 or 3 strains of the germ. And we think there may be 15 or 20 that can cause a problem. So usually I suggest that people take a look at the symptoms. And if they have enough symptoms to suggest Babesia, we call that Babesia. Okay. So symptoms that make you think of Babesia can be drenching night sweats at night, panic attacks, racing and skipping of your heart, Periods of low blood pressure, like you get with your POTS, for instance, can be part of Babesia. Headaches, frontal headaches in the front of the head, and then I guess that's why they're called frontal headaches, but headaches in the front of the head, and then migraine headaches sometimes can be part of Babesia as well too. Okay, but if you have enough of those symptoms, then we say it might be Babesia. And one of my more favorite Babesia symptoms, just because it's the most interesting one, is sometimes people with Babesia get very frequent deja vu experiences. Okay, so that sense when something happens that you've been there before, that happens quite often in a number of people that have Babesia too. Okay, all right. Michelle, good luck to you. Hello, JT. Let's see, hi, Doc. Hope you're staying well. I am, thank you. Let's see, my Igenix immunoblot IgM showed a positive 23 band and an indeterminate 41 band. So technically both CDC and Igenix criterion are negative. The IgG showed reverse with 23 indeterminate and 41 positive, as well as the 18 band positive. Still CDC and Igenix criteria negative. Co-infections were all negative. I scored 72 on the Horowitz Lyme questionnaire and 298 on your yeast questionnaire. I've also been exposed to mold. I'm having neuromuscular type symptoms to include atrophy and fasciculations. My questions are, is the 23 band highly indicative of Lyme? As I understand, 18 and 41 aren't. Do you ever see muscle atrophy with Lyme disease or mycotoxin yeast issues in your patients? And 3, is CSF more accurate than blood when testing for Lyme and neurolyme? Okay, so no more questions there. So CSF, I think what you mean is cerebral spinal fluid, or the liquid that you get when you do a spinal tap. It's the liquid that's around the brain, and that also is along your spinal cord. All right. What we have found is that when people have florid Lyme, you can tell it really is neurologic Lyme, whether they've got patterns that show up in an MRI, or they just have a lot of neurologic symptoms that make you think it's in the spinal cord or it's in the brain, that unfortunately the testing of the cerebral spinal fluid will only find it about 50% of the time. Okay, so it's using CSF to see if you have central nervous system Lyme is not that accurate. It will only find it if it's there 50% of the time, okay? That compares with using your immunoblot that can find Lyme if it's there about 95% of the time. And that's based on validation studies that looked at the accuracy of the Igenix immunoblot. Their in-house validation studies say they can find 95% of cases, okay? And that compares with the Centers for Disease Control and FDA, Food and Drug Administration method of doing the Western blot. Their method will only find it about 60% of the time, okay? So looking at your CSF is even worse than the FDA CDC Lyme test outcome. So it's not that good, okay? All right. Let's see. In terms of muscle atrophy, muscle atrophy means wasting away of your muscles. You get less and less muscle mass. You can see that in mold toxicity. You can see that in Lyme. You can also see it if you have something that's causing injury to the nerves at the level of the spinal cord, like in Lou Gehrig's disease or amyotrophic lateral sclerosis, which is Lou Gehrig's disease. That is some injury to what's called the dorsal ganglia, an area near the spinal cord. And if those nerves aren't working correctly, they don't send good signals to the muscles to maintain their muscle mass, and you get loss of muscle mass. Regarding Lyme and mycotoxins, one of the ways that they can lead to loss of muscle mass is that the increased cytokines that get made by the immune system in trying to get rid of those problems, those increased cytokines can cause muscle atrophy as well too. It could even happen with yeast too, okay? So everyone's cytokines, that's I guess my first time of mentioning it tonight. Let me just do my quick cytokine discussion here, because you'll hear me mention it a number of times later tonight. So when your immune cells, your white blood cells, see an infection or see a mold toxin or see yeast or see Lyme, they try to get rid of it. And one of the things that some of the white blood cells will do is they'll see those germs or those toxins, and they'll manufacture a group of chemicals called cytokines. All right. Now, cytokines are good and bad. On the good side, they cause more white blood cells to be made. They draw those white blood cells where the infection is, and they help those white blood cells work better. Okay. That's all good. All right. But in Lyme and in mold toxin issues and in yeast sometimes, the immune system does not do a good job of dealing with those problems, but it tries harder and harder, and eventually it makes too many cytokines. All right. Too many cytokines can give you muscle atrophy. They can make it so you can't think. They can make you hurt all over. They can give you joint inflammation. They can make it so your nerves don't work correctly. They can make it so you can't think. I think I mentioned that already. Anyhow, they cause most of your symptoms that we call Lyme symptoms are too many cytokine symptoms. The symptoms we call mold toxicity symptoms are too many cytokine symptoms. A lot of the symptoms of yeast overgrowth in your intestines are too many cytokine symptoms. Okay. All right. So I just want to point that out. All right. And many of you know one of the core things I suggest as part of Lyme treatments is do supplements, do things that will lower your cytokines. Okay. And I'm sure we'll cover some of that later tonight. All right. Then, in terms of looking at your background, when I'm trying to diagnose somebody that has Lyme, there's actually 4 things we consider. Okay. Number 1, what's your risk of getting it? The highest risk would be if you had a tick bite in New Jersey, where 95% of ticks are estimated to carry Lyme. Okay. But any kind of a tick bite could be a risk factor. Are you a hunter? Do you do a lot of camping? Do you do things that might expose you to Lyme? Okay. So we have to consider what's your risk of getting it. Number 2, we got to consider, do you have enough symptoms that look like Lyme? Okay. Number 3, we look at, do you have any physical exam findings that we can see that are consistent with Lyme? And then the 4th thing we consider is, do you have supportive testing? Okay. Now, the Horowitz questionnaire that you did, everyone, Richard Horowitz is a Lyme doctor that has written a couple books about Lyme management and has come up with a questionnaire. And on his questionnaire looks at what are your risk factors, like have you been bitten by a tick, okay? And it also looks at a lot of your symptoms. And if you score high, then it is a good predictor that you probably have Lyme disease, okay? It's not conclusive, but probably a good predictor, okay? So, and then JT, in terms of your testing, I would say that your immunoblot test on the let's see here. I would call both the results you have on your IgM and your IgG, I would interpret them as indeterminate. They're not positive or negative. And so the way that you get a positive IgM or IgG immunoblot is to have antibodies against 2 of the important proteins. And those proteins are those numbers, okay? So there's a protein that weighs 23 kilodaltons. That's why we call it the 23 band, okay? There's another one that weighs 41 kilodaltons. The important ones, the ones that are most specific for having Lyme, are 23, 25, 31, 34, 39, 41, and 83, 93. And the test is positive in general if you have antibodies against 2 of those 6 that I just said, 2 of those 6 proteins, okay? Now, given that there is kind of, they're not negative or positive by my interpretation, I would give some weight to the Horowitz score. I would need to talk to you a little bit more, though, and find out what are your risk factors for possibly getting it too. And it's possible, just based on your Horowitz score, symptoms, risk of getting Lyme, that I might even just say, even though their testing is indeterminate, I might even reinterpret it to say it's weakly positive, okay? So in terms of whether you have Lyme, if you wanted my opinion on that, what I would probably do is set up some time to talk with me on one of my consult visits. I'd be glad to help take a look at this with you and to let you know whether I think it's Lyme or not Lyme. Okay. All right. All right. Thanks for that question, JT. Go ahead and get rid of that. And then I want to do a quick screen share, everyone, show you something here. All right. So in terms of, hold on here a minute. All right. So in terms of how do you diagnose Lyme disease? Again, remember I said there's 4 things we look at. I've done a pretty detailed video about how do you diagnose Lyme. So I just want to show that to you. So take a look at this article called How to Diagnose Chronic Lyme Disease. It's called More Than a Test. Okay. And this is based on a presentation I made at one time that I recorded into the video for this. Okay, all right. The other thing, in terms of testing, because now we've seen tonight there's the words immunoblot. I mentioned Western blot. Some of you may be aware there's a test called the Ellis spot, and you may be wondering, what test should I do? Take a look, and we may cover this more later, but in terms of what testing options you have, take a look at this section called test here. And in this article, I actually review the various ways you can test for Lyme and give you a grade as to what I think the best way is. And these days, I think the best way is the IGeneX immunoblot test, which I think is better than their Western blot test, which I think is better than the Armin Ellis spot test. Okay, so take a look at this article or review those two. Okay, all right. All right, so one thing to point out too is you can have negative testing and still have Lyme. There's sometimes we will make a decision to diagnose that based on the clinical presentation. One of the reasons that you may have negative testing and still have Lyme is that because of immune suppression from Lyme, the immune system may have a hard time making the antibodies that we're trying to measure with an immunoblot or with a Western blot. Okay. All right. Let's see here. Naomi, you've written a really long question. I know you put a lot of work into that, but I'm not going to be able to answer it here. It literally will, if I try to post it, it will freeze my whole screen up. And given the length that it is, it's going to be too hard for people to comprehend for me to read it, okay? If you would like to, feel free to write me your question, excuse me, to my regular email. And that email is Doc Marty, is DOCMARTY at martyrossmd.com. So that's MARTYROSS and then the letter M, the letter D.com. And I'll try to get a response back to you. Okay? All right. Let's see. All right. This is a few parts from Sarah, and I think that we'll see what we can do here. So, hi, Dr. Ross. In one of your past newsletters, you what did happen here? Spoke about using Rocephin in conjunction with another antibiotic. Let's see here. I guess an intracellular one. All right. So let me see here. Trying to see if there's more to your question here. No. All right. So everyone, Rocephin is also known as ceftriaxone. And if I'm going to use it, I'd like to combine it with, there are a number of things to combine it with, but I like to combine it either with metronidazole or tinidazole. And so what the ceftriaxone Rocephin does is it is good at treating the spirochete. So many of you know Lyme lives in you in 2 states, okay? So it lives in as a corkscrew-looking thing called a spirochete. Okay, you probably see pictures of that on the internet. It also lives in a microscopic cyst form of the germ. And the spirochete can convert to the cyst, and the cyst can convert back to the spirochete, okay? So when we design treatments, we've got to give you something that's going to go after both of those forms. The other thing we have to do when we design a treatment is we need to we recognize that Lyme has the ability to live outside of your cells and inside of your cells, okay? So we need to use agents that can get at both of those places, all right? So the Rocephin, the IV ceftriaxone Rocephin, is useful at treating the spirochete that lives outside of cells. It does not get inside of cells, okay? All right. The way it works on the spirochete is it basically, in effect, prevents repair of the spirochete of its outer covering. And because the spirochete cannot repair holes that start to develop in its armor, if you will, it eventually gets a lot of holes in its covering, and as it grows, it bursts its covering, basically. Okay, you can kind of think of it that way, all right? All right. What the tinidazole and metronidazole do is they get inside of cells so they can treat intracellular Lyme. They also are good anti-cyst agents, and they also work outside of cells too, okay? So we can use that combination of a tinidazole along with the Rocephin to be a comprehensive treatment for Lyme, or you can use it with metronidazole. All right. Now, I prefer tinidazole over metronidazole because there's some petri dish experiments that were published about maybe about 8 years ago now by Eva Choppy. That's Dr. Choppy is a researcher that runs a Lyme disease research lab in New Haven, Connecticut. And what she was able to show is that tinidazole is really good at breaking up biofilms, okay? It breaks up about 95% of these slime layers that Lyme has the ability to grow that cover it and hide it from antibiotics and hide it from the immune system, okay? 95%, okay? Now, keep in mind, though, any antibiotic can break up biofilm to a degree, all right? Now, I know everyone thinks that they have to take something that's just breaking up biofilms, but what I want to let you know is you can actually treat Lyme without necessarily being on a specific biofilm buster because the antibiotics can do a fairly good job too. Like doxycycline, according to Eva Choppy's experiments, break up about 60% of biofilm, okay? There are times, though, that because biofilms can be one of those things that limit antibiotics effectiveness and also block the immune system out from helping us get at the germs, there are times that I will wind up putting a person on something that's even stronger than the antibiotics to break the biofilms up, okay? And there's a variety of things that we can use to do that. I'm not going to go into it now, but there is an article that I have that describes the various things you can do to break up biofilms, and you can find that at treatlyme.net. Look in under the Lyme guide and look at the article I've written on biofilms, and I cover a variety of ways that you can do that, okay? All right, thanks for that question. Oh, shoot. Let me just do a quick screen share here. All right. So this is back at my Lyme disease information site. If you look at my online Lyme guide, and then you take a look at my section here on biofilms, I talk about how to get rid of biofilms in this article called Biofilms, Lyme Disease, Gated Communities. Okay, all right. And I talk about a variety of things you could take that would actually break those apart. Now, I usually don't put somebody on a specific or strong biofilm buster until about 6 to 9 months into treatment if the things that I'm doing to help them are not giving good benefit by around that time. I might start thinking about putting somebody on an herb or a supplement that would help break those biofilms apart. Okay? All right. Thanks for the question. Bear with me here. I'm getting rid of those multiple parts of Sarah's question here. Hello, Justin. Let's see. Hi, Dr. Ross. Is mast cell activation syndrome very typical with chronic Lyme and co-infections? Does treating mast cell activation syndrome help with recovery or only symptom relief? It helps with recovery and it helps with symptom relief. Okay, so everyone, there's this condition that many people with Lyme, not all, but many people with Lyme can develop, which is called mast cell activation syndrome, okay? So mast cells are one of the kinds of immune cells that we have. And inside mast cells are where histamines are made. And historically, we only thought that mast cells were actually involved in allergies. We now know better than that. But at one time, what we really thought happened is that if you had something you were allergic to, like pollen or cat dander, and it would land on a mast cell, and it would, and if there were antibodies attached to it as it landed on that mast cell, it would cause the mast cell to release histamines. And those histamines are what give you the runny nose, the itching, the hives, those things that we call allergic reaction. Those are reactions that are mediated or caused by excessive histamine release. Okay, all right. Now, we now know, though, that there are many things, other things that mast cells do. And in fact, mast cells are big producers of cytokines. Remember I mentioned cytokines earlier tonight? Well, one of the type of cells where they're manufactured is within mast cells. And it now looks like when you have chronic infection, the chronic infection not only causes the mast cells to manufacture cytokines, it also causes mast cells to manufacture and release histamines. So it can make it look like you're having ongoing low-grade allergic reactions that show up with allergy-like reactions, runny nose, itchy nose, hives, or a lot of marked food sensitivities, for instance, a lot of belly pain, or headaches after you eat certain things, or confusion after you eat certain things. Those are kind of situations you might start thinking about mast cell activation. Now, it's hard to say, maybe everyone with Lyme, because the mast cells can get activated from infection, maybe everyone has a degree of mast cell activation with their Lyme. We don't know. No one's done the studies to say, does everyone have some degree of mast cell activation? Okay. But the mechanism, because they'll get turned on from fighting infections, yeah, it's probably a component in everyone that has Lyme. I think it would be fair to say that. However, that doesn't mean we need to treat it in everyone. And the people we want to treat it in are people that are having problems from having those turned on mast cells, okay? And those problems, again, can be a lot of abdominal pain, can be that they react to everything that we give them, or they can have a lot of allergic symptoms, or they have headaches, or they have confusion. And if so, then we want to treat for the mast cells. We want to give things that will help stabilize those cells so that they're not making and manufacturing histamines, okay? All right. So let me just show you, if you want to read more about this, take a look at an article that I've written about mast cells. All right, so you're going to want to look at my immune chapter here. And here's my article on mast cell activation syndrome and Lyme. Okay. Now, one of the reasons you want to stabilize those mast cells is when they're making too many histamines, they're also making too many cytokines, okay? And excessive cytokines can suppress your immune system and make it harder to get over the Lyme, okay? All right. In terms of, I talk about in the article, my two favorite herbs to stabilize those mast cells are quercetin, which is a chemical that comes primarily from onions and other colorful fruits and vegetables. And I like to do that as at least 500 milligrams twice a day when I'm using it as a mast cell stabilizer. Okay. And the other thing that's good is something called luteolin, and that's Luteolin, luteolin. And the way to use that is to take 100 milligrams at least 3 times a day too. Okay. All right. Thanks for the question. Hello, David. Hold on here just a minute. Hi, Dr. Ross. Let's see. Thanks for all you do, and I hope you are well. My question has to do with the possible vaccine that is in the works for the coronavirus. I am concerned that this vaccine will be mandatory for everyone and will possibly be a live vaccine. As someone who always had reactions to every childhood vaccine, hives was the very least fevers, etc., I'm greatly concerned, almost as much as if I was to get the virus. As someone who is completely heterozygous for MTHFR, has Hashimoto's, and has battled Lyme and babesiosis and Epstein-Barr virus in the past, what can we do to protect ourselves if it is forced on us? Yeah, David, that's such a hypothetical question because it's still not clear what is going to take shape with the vaccine or if they'll even get one. I mean, I hope we do. Look up, but we've been thinking about HIV, for instance. We still don't have a vaccine on HIV, and look how long that illness has been a problem, okay? And yes, there can be live vaccines and there can be vaccines made up of proteins or genetic components. And at this point, we really have no idea what that vaccine is going to wind up being. I mean, a lot of people have different ideas on it, but we really don't know. As far as whether somebody's going to have the option to not participate in it, I suspect there's going to be some reason to do that. Again, this isn't the same thing as, or not again, but this is not the same thing as childhood vaccines, for instance, where we've had measles spreading and whooping cough spreading, and we're now immunizing kids to keep them from getting greatly injured by these. Keep in mind with COVID-19, kids generally are doing okay. So I don't know that we're going to be mandating that everyone has to get this vaccine. We might. But beyond that, I guess I don't have specifics for you yet because I'm not sure what the full reaction and negative reaction is going to be from a supposed vaccine that has yet to be developed, okay? So it would be all just way too hypothetical at this point, okay? All right. Thanks for that question, David. Good luck to you. Hello, Megan. Hello, Dr. Ross. I'm wondering about your experience has been with people who have been on long-term antibiotics for Lyme and co-infections and they're recovering from candidiasis. Is it typically an ongoing issue that they have to keep fighting long after they resolve their infections and have stopped the antibiotics? Or generally, can one fully recover from systemic yeast overgrowth after long-term antibiotic use? Also, do you find the medicinal beneficial mushrooms such as reishi or cordyceps to contribute to a yeast issue, or much like Saccharomyces boulardii actually assist in competitive inhibition of pathogenic yeast? Thanks. All right. So in terms of, let me just talk about Saccharomyces boulardii first. So Saccharomyces boulardii, everyone, is something we use as a probiotic because it is a germ that actually lives in our intestines, okay? And if we put more of that good germ in our intestines, the intestinal makeup of bacteria and healthy yeast and intestinal function can improve, all right? Now, Saccharomyces boulardii is a healthy yeast, okay? And so anyhow, I support it. I think it can do a good job. It can be part of a yeast overgrowth treatment protocol as well, too, because they're healthy yeast that you're putting in. The kind of yeast that we get that gives us yeast overgrowth is a different family of yeast. They're called Candida, and the main one is something called Candida albicans, okay? All right, now, do reishi and cordyceps help with yeast infections? That has not been my observation. They don't hurt it, but I don't think they help somebody get over yeast, okay? What does seem to help people get over yeast is to put a lot of good probiotics in to compete against the yeast, okay? And to use antifungal agents, all right? Now, to answer your question, I think that most people, so when you're on antibiotics, part of the problem that can happen is by knocking down the good bacteria that are supposed to inhabit your intestines, that sets the stage so that yeast that also live there can grow too much. And you can get into intestinal yeast overgrowth, okay? And intestinal yeast overgrowth can cause too many cytokines, so it can make it look like your Lyme is still active, for instance, okay? And it can give you sugar cravings, can give you a lot of intestinal gasiness and bloating, can lead to food allergies. So too many yeast can create quite a mess, all right? But typically what I find is for the majority of people, Once we stop antibiotics, as long as we do a good job of putting probiotics in for, say, 6 months to a year, the majority of people probably are going to go on and not have problems with systemic or intestinal yeast overgrowth. Okay, majority. Now, there are some people that that do have repeated problems and that they are going to go on and have recurrent yeast infections, but not everyone. And sometimes what I'll do at the end of my treatments is I will, if I think somebody has low-grade yeast at the end of the treatment based on my review of their symptoms, I may put them on diflucan right after I get done stopping my antibiotic treatments by having them take diflucan as a 200 milligram pill, 1 pill a day, and combine that with nystatin as a 500,000 international unit pill, 2 pills twice a day, and then combine that with both a human-based probiotic, meaning using the same kind of bacteria that live in our intestines. I like using something called HMF Forte, and I'd have a person do 4 of those 1 time a day. And then I also like to throw in soil-based probiotics, and these are bacteria made up of bacteria that live in the soil. And these probiotics, although they're not regular inhabitants of our intestines, actually do a good job of promoting the good bacteria that live in our intestines to work better and to grow and take a better foothold. Okay, so I like using 4 pills 1 time a day of something called Corebiotic by Research Nutritional. So at the end of treatment, what I'm doing to deal with somebody that might have yeast, to try to clear it out, I'm doing a month of diflucan. I'm going to do 6 months of nystatin, and I'm going to do probably 6 months to a year of 2 probiotics. One is HMF Forte, and I'm going to combine it with the soil-based probiotic called Corebiotic, and I would do 4 pills of each of those. Okay, all right. So let me just do a quick screen share here. I'm going to show you some things that you can take a look at. Okay, so first of all, if you're wondering what I recommend for probiotics, because again, there's a lot of quality variation on probiotics, take a look at here. And I mentioned the Saccharomyces boulardii. I carry a thorn product for that. I carry 2 types of soil-based probiotics from Research Nutritionals. One is called Corebiotic. The other one is Corebiotic Sensitive. The difference between these is the Corebiotic uses a fiber as a prebiotic to support the probiotic, and a Corebiotic Sensitive does not, because in some people that prebiotic fiber can make them very gaseous. Okay. Another soil-based probiotic is this Proflora. Okay. And then finally, the human-based microflora that I like to use is this HMF Forte. All right. Now, in terms of probiotics, I actually have an article on those. Let's see here. I probably have it under stomach and intestines. Let's see. Yeah. So this is my review of probiotics and how they work differently, how a Saccharomyces works differently than an HMF, for instance. Okay. You can find it here. All right. All right. Let's go back here. All right. Good luck to you, Megan. Thanks for the question. Hello, Yvonne. Hold on here just a minute. All right. Let's see. Hi, Marty. Do you know of any good reference books or resources that provide information about herb-to-herb interactions? Is it also safe to take Cryptolepis and Sida acuta along with Hutania? And if so, can cat's claw otoba bark also be added? So I don't find any adverse interactions in using Crypto, Sida acuta, Hutania, cat's claw, and otoba bark together. In fact, I do pretty often in my treatments. Okay, so Cryptolepis, everyone you may be familiar with, is an herb that can treat Babesia. This also can treat malaria. Sitta acuta and Hutania are two herbs that I learned about through Buhner Herbs and his protocol. I find they work about 70-75% of the time effectively against the co-infection Bartonella. And then the cat's claw and Otoba bark come to us out of the Cowden protocol using those two together. And they work very well, and based on Petri dish experiments, they work really, really well. In my clinical experience, I find they work about as well as prescription antibiotics do. And those two are effective at treating Lyme, okay? I do have articles on all of those. I'll show you where you can take a look at some of the information on them here in a second. But in terms of books that would have drug-to-drug or herb-to-herb interactions, I haven't seen any that really describe the kind of herbs to herb interactions that we might see in the kind of herbs we use in Lyme disease. Okay. All right. Unfortunately. Okay. All right. But I do mix these together quite often. All right. So let me just do a quick screen share here again. Okay. So if you're looking for herbs that can treat, well, actually, if you want information on the cat's claw and Otoba that I've mentioned a number of times tonight, because actually they even break up 100% of biofilm when they're used together. So I've written an article called Otoba bark extract and cat's claw. Okay, it's even got a video that goes along with it, and this is, I think, very useful in terms, or this article is very useful in helping to understand the benefits you can have from working with these. Again, I find them helpful about 85 to 90% of the time in Lyme. All right. Now, if you're looking for ways that you can treat Bartonella, you can click on this article, and within here, under my tier 3 treatment is Hutania and Sitta acuta. Okay, so I talk about those two herbs there. And then in terms of how to treat Babesia, I talk specifically about prescriptions, but I also mention a couple herbs that you could consider using. And those two herbs are Cryptolepis and artemisinin. Okay, so here's the artemisinin here, and then here's a description of the Cryptolepis there. Okay. All right. Yvonne, thank you for that question, and good luck to you. Hello, Lisa. Let's see. I was told I have high oxalates from an oat test. Should I be taking mega doses of vitamin C to protect from COVID with high oxalates? I honestly don't know. I haven't looked at that angle or been following that angle enough to be able to say that, Lisa. I'd have to look into it. I'm sorry about that. All right. Thanks for the question. Hello, David. Let's see. Hi, Dr. Ross. I hope your day's been good so far. Have you read the study by Stanford School of Medicine touting Azlocillin as a promising resistant Lyme treatment minus a lot of side effects? As of a published date, Azlocillin is currently not on the market, but in the same article, disulfiram is mentioned. Are you seeing more positive results with disulfiram in your practice, or are multiple antibiotic combinations combating the infections better? And lastly, burning neuropathy on the bottoms of my feet just started a few days ago. Any supplement suggestions for this until I can see you? Thanks. All right. So, David, I am aware of the Stanford article on the Azlocillin. And even though Azlocillin, I believe, has been FDA approved, there just isn't anyone manufacturing it here in the States in a pill form. I believe the researchers that did the Azlocillin study is the same lab that discovered that, actually, I don't believe, it is the same lab that discovered that disulfiram could be useful in terms of treating persister Lyme. And if I remember right, when I read this article about the Azlocillin, they showed that it's useful for treating both persister Lyme and I think actually growing Lyme as well too, okay? So everyone that's not familiar with the concepts and words I just said, let me talk here briefly. So we've known for some time that people with Lyme, certain people have a hard time getting over it, all right? And there's a variety of reasons for that. One is Lyme hides in places it's hard to get the antibiotics to. The germ has the ability to form a slime layer called biofilms that protect it. It exists in two forms, a spirochete and a cyst form. So you got to design treatments that go after both. But one of the things that's really started getting the attention is that we've been wondering, and we now have research over the last 4 years or more now that shows that Lyme has the ability to form what are called persister forms or take on a persister state. And what that means is some of the spirochetes and some of the cysts, not all of them, some of them, have the ability to go into hibernation when they've been exposed to antibiotics for a while, okay? And in these hibernating forms, they basically slow their metabolism way down and they ignore the antibiotics, all right? So there's been a lot of attention on this. And right now we've got a lot of good Petri dish experiments showing of things that might be helpful, like disulfiram is shown on Petri dish experiments or lab experiments to be useful. And we've got some clinical evidence based on case reports that disulfiram can be helpful now, okay? But other things that are being mentioned, Azlocillin, it looks promising on Petri dish experiments. I don't know how it's going to work when we get into real humans using it because we're not doing it that way right now, okay? And just because something works on a Petri dish does not mean it's going to work in a living person, okay? We also have ideas about treating persisters that are coming to us out of Johns Hopkins University. The lab of Dr. Ying Zhang out there has been doing some impressive work looking at various things on a Petri dish that might work for persister Lyme and even persister Bartonella. So for instance, his lab has shown that something called methylene blue can be quite helpful for both of those persisters, Lyme as well as Bartonella. Oregano oil can be helpful according to Petri dish experiments as well too. And so, we're trying all these different things that we got coming out of the labs on laboratory experiments, still not sure how many of these things are going to play out and really work well over time, okay? Now, of the treatments that I am finding helpful for persisters these days, I am finding benefit by using the disulfiram. I know, which is the antabuse. I know when it was first started being used, a lot of my colleagues were using it as a standalone medicine, meaning they weren't using any other antibiotics with it. For some of my patients, I am using it just as a standalone medicine, but because it primarily targets just the persister form, I more recently have been designing treatments that actually use it to treat persister while I'm using something to treat spirochete Lyme and while I'm using something to treat growing cyst forms of the germ too. So I'm coming up with multiple antibiotics that are using the disulfiram just to treat persisters, okay? And some people, I start with the disulfiram first. If we're not getting far enough along, then I might add in these other antibiotics, okay? Instead of using disulfiram, I do use oregano sometimes, oil in some people if they cannot tolerate disulfiram, or if they've got a psychiatric history that suggests to me there's not going to be a good candidate on disulfiram because disulfiram can trigger quite a bit of psych reactions in about maybe 10 or 20% of people. And if I've got somebody that's got a lot of neuropathy, I might not use the disulfiram either because disulfiram can lead to neuropathy. So I might use oregano or methylene blue in those situations too. Okay. All right. Now, in terms of, I'm interested in seeing if this Azlocillin actually can get in a pill form. I'd be willing to give it a try. What I'm really interested in is if we can get some human studies to see if it really is going to be something that's going to be as promising as it looks. Okay. All right. Let's see here. I mean, I would just caution you, a number of years ago, Ying Zhang's lab, remember I talked about him, did an experiment where they showed on Petri dishes that using an antibiotic called ceftriaxone combined with daptomycin, combined with doxycycline, I believe. Looked like this was going to be the cure-all based upon laboratory experiments and dealing with persister Lyme. They subsequently then tried it on mice, and even in the mice it did great, got rid of their Lyme. But then most of us that tried it on our patients found it went nowhere. So what we see in either petri dish or in mouse experiments sometimes does not translate into something that's really useful in a person. Okay, all right. Now, finally, your question about how do you repair neuropathy? What do you do? There's two basic parts to that. Three basic parts. Number one, when your nerves are injured, they're probably inflamed. And the main thing that can be leading to that inflammation is the cytokines that are being made in excess. So I like to get people on curcumin. And for that, it's the Thorne Meriva 500, which is a liposomal curcumin product. I like using the liposomal curcumin because it's better absorbed and it's going to have a greater chance of helping a person. Okay. So it's 500 milligrams 3 times a day, get the inflammation down. Okay. Second thing I like to do is work with a very powerful antioxidant that's manufactured in every one of our cells, but in injured cells gets overused and gets depleted because it's used by injured cells to repair themselves from the inside, okay? And that's glutathione. So if your nerves are injured, they may have exhausted their glutathione supply, and their glutathione is supposed to be helping to repair them from the inside, but if it's depleted, it can't help. So you got to fill your glutathione gas tank back up, all right? And my favorite way to do that is to work with a research nutritionals product, which is called Trifortify Orange, also known as called Trifortify Watermelon. Those are the two flavors. And it's a liposomal glutathione. Liposomal means it's microscopically wrapped in fat to increase its absorption. And the way you would do it is a teaspoonful once or even twice a day, okay? And the research nutritionals product is interesting. They've got some good studies that show that it really does get absorbed quite well in their liposomal form, okay? All right. Regarding glutathione, non-liposomal forms probably are getting destroyed in the stomach and are not that well absorbed. So it was interesting to me when I looked at the research nutritional studies that showed marked increases in glutathione inside red blood cells, suggesting it is getting absorbed and being helpful within our cells. Okay. All right. All right. So you want to use curcumin with Meriva 500 to get inflammation down. You want to repair from the inside with glutathione. The third thing you want to do is repair the damaged nerve membrane as well as injured cell energy factories called mitochondria. And I like doing that. It's called phospholipid repair, meaning you give the fats that make up the covering of your mitochondria and your nerve membrane, okay? And a product I like for that is something called ATP 360 by Research Nutritionals. And I would use that as 3 pills 1 time a day. Now, I want to let you know they have an older product called ATP Fuel. You could use that. It's 5 pills twice a day, but it's harder to use because it's twice a day and those are a lot of pills to take, okay? But their newer product, this ATP 360, it looks like it's doing a good job. It's easier to take 3 pills 1 time a day, okay? The only thing I would caution you with the ATP Fuel or the ATP 360 is they both have Research Nutritionals added some CoQ10 into those. And if you are using atovaquone, which is found in Malarone and Mepron to treat Babesia, you do not want to use the ATP Fuel, and you do not want to use the ATP 360 because that CoQ10 in there may decrease the ability for the atovaquone to work and get rid of your Babesia. If that's the situation, what you want to use for your phospholipid repair then is to do something called NT factor, which is made by Research Nutritionals. It doesn't have any of the CoQ10 in it. And you would start at 2 pills 3 times a day. Okay? All right. I'm going to show you an article here in a second you can take a look at with these recommendations for your nerve repair. Okay? All right. Anyhow, I think that answers your questions. Good luck to you. And if you do get here, I'd be glad to help you with this as well too. Okay? All right. Let me just do a screen share here. Okay. So in terms of the nerve repair, take a look at this section called Brain and Nerves. And take a look at this article about how to repair nerve injury. Okay. All right. The other thing in terms of these three products, the ATP fuel and the NT factor and the ATP 360, I've written an article comparing these three products, and it's called A Comparison of ATP Fuel, ATP 360, and NT Factor Energy by Research Nutritionals. Okay, so if you need more information or the science, you can take a look here as well too. All right. Let's see here. Hello, Heather. Let's see. Hi, Dr. Ross. Thank you for doing these. My doctor started me on the full Cowden protocol. Stevia seems to be a migraine trigger for me, and I know that you're not a fan of it. Is there something else I can replace it with? I was thinking possibly the oregano oil that you will have in your store. Also, what are your thoughts on the Azlocillin? When will it be available? Okay, so I already talked about the Azlocillin earlier. Okay, we don't know when it's going to be available. I know that Dr. Rahadis, who was the doctor that discovered the disulfiram, I believe he's trying to put together a company that will manufacture that. Okay, at least that was my reading on that when I saw that article before. Okay. In terms of the stevia, you probably don't need it. I don't find the reason I don't like using stevia because I've never found it to be that effective. I have not found people when I add it as a single agent to do anything that suggests it's even working to remove biofilm. That's what we think it's supposed to be able to do. I know in petri dish experiments, Dr. Shoppi's lab showed that it can remove biofilm, but in practical experience, I've never seen it to do anything. Okay. All right, the Cowden protocol, if you're doing the Cowden protocol, though, if you stay on the Atoba and cat's claw, those two together, according to Eva Shoppi's research, the same Dr. Shoppi I just talked about with stevia, her research says they break up 100% of biofilm, okay? And so that's probably, to me, that's the best part of the Cowden protocol, is that part right there, okay? All right. Yeah, I think that answers that. Good luck to you, Heather. Thanks for that question. Let's see. Hi, Steve. Let's see. Hi, Dr. Ross. I contracted COVID-19 back in mid-March. After a long battle, I have since developed secondary pneumonia, common with the COVID-19 recoveries, which has caused constant fatigue and sharp pains in the lungs. I have just started a course of clarithromycin to treat this, as I have Lyme and Babesia, which is suppressed at present. My question is, would pneumonia in any way bring out the Lyme infection or interfere with the Lyme disease, i.e. resurface it after the antibiotic treatment, which is a 6-day course of 1,000 milligrams a day? Also, would it be beneficial to add a zinc supplement while on the clarithromycin? Okay, so, granted, I haven't seen somebody that got COVID-19, then went on and got secondary pneumonia and had Lyme in remission. All right, I haven't had that. Your particular setup I have not worked with before, okay? But I have taken care of people that have Lyme, that did not have COVID-19 but got pneumonia, that were in remission, and I haven't seen their Lyme reactivate by treating. So I'm doubtful that you're going to see your Lyme or co-infections reactivate from using the clarithromycin to treat the bacteria infection that you have, okay? All right. In terms of zinc helping the clarithromycin, or zinc being beneficial, the zinc can help your immune system work better. It might benefit, but I wouldn't call it. I would say maybe it would. I don't know for sure that it will. Okay. All right. Thanks for the question, Steve. And good luck to you. Hello, Whitney. Hi, Dr. Ross. Do you have an optimal range of cortisol and aldosterone levels you'd like to see in a Lyme patient who battles chronic infections and viruses? My numbers remain low despite being on hydrocortisone and licorice root for years. The fludrocortisone gives me bad headaches. Any suggestions? I don't have a specific recommendation on the aldosterone. I do like trying to get my early morning fasting blood level of cortisol so that it is 16 or higher. Okay. And if I have to use Cortef or hydrocortisone, fludrocortisone to do that, I will. You can dose those up to 30 milligrams twice a day and still, even though those are steroids, 30 milligrams twice a day would still be considered to be physiologic, meaning the amount that our adrenal gland should make, and therefore would be immune supportive and not immune suppressive. Okay? All right. Thanks for the question, Whitney. Hello, Kay. Hi, Marty. I have Lyme and mast cell activation syndrome and now Hashimoto's. I started Nature Throid, and I feel it is making my MCAS worse. Have you seen this? Also, some people are saying Nature Throid doesn't work anymore. Any comment on that? I feel no difference, but my dose is only up to 1.25 grains. Thanks. All right. So Nature Throid, everyone, is basically ground up thyroid gland from pork. And so even though it says Nature Throid, it's because it's coming from, it's not synthetically made, okay? And that Nature Throid, because it's whole thyroid gland, not only does it have the two thyroid hormones that our thyroid gland make, T4 and T3, but it also has other substances in it that are part of thyroid tissue. There is an occasional person I have found that does have allergic reactions to the Nature Throid, okay? Because it's not pure thyroid chemical in the sense that you would get if you did a synthetic thyroid medicine like Synthroid, for instance, or levothyroxine, which is the same thing as Synthroid, okay? So yeah, I have seen allergies and allergic type conditions like MCAS worsen for some people on Nature Throid, okay? In which case I get them off of it and I will use Synthroid instead. And I might use something called liothyronine instead, okay? All right. Nature Throid, I find works, has as great a chance of working now as it used to. So I'm not sure where somebody's come up with this opinion that it's not working that well anymore. Okay. All right. Thanks for the question, Kay, and good luck to you. Hello, Rich. Dr. Ross. Sorry, this is a repeat question from the February 6th webinar, but unfortunately the audio was not working when you answered it, so here it is again. I was diagnosed with cat scratch disease 40 years ago by way of removal of a swollen lymph node in my groin area. No other symptoms that I recall. Fast forward 10 years later, and I came down with a mystery disease that included swollen and infected eyes, muscle twitching, headaches, irregular heartbeat, sores on my skull only, and joint and back pain. Whatever it was, it cleared almost entirely by taking about 30 days of tetracycline, prescribed by an ophthalmologist for my eye infection. Does that sound like symptoms of BART? Does the diagnosis of cat scratch disease mean that I will always have the Bartonella germ in my body? And is there a strain of BART that may include symptoms I mentioned, but not others that I see associated with the disease, such as stretch mark-like rash, etc.? As always, okay, so Rich, I think I actually did answer this in the webinar afterwards because you posted it in that one too. So anyhow, I will just be brief here. When I look at your symptoms, other than the muscle twitching that you had, I don't. This does not say Bartonella to me. Okay, all right. So based just on this alone, I don't know what this was. Could it be Bartonella? Possibly, but you don't have a lot of symptoms that are screaming Bartonella at me here. Okay. Keep in mind also, it is possible the immune system has the ability to deal with Bartonella. So even when you had that lymph node when you were younger, it may be that that your immune system stepped in and actually took care of the infection as well too. Okay, all right. Good luck to you, Rich. Thank you for that question. Hello, Iona. Let's see. I'm wondering if you have heard about this, and if so, what your experience is with it. Antisense oligonucleotide therapy. Okay, so I'm so Iona. It's a newer, what I would call experimental treatment, meaning we just don't have a lot of collective knowledge of using it. I'm more familiar with the SOT side of it. And basically, it's a way of, I believe, trying to turn on at the genetic level, a rebalancing of your immune system so that it may work better to deal with Lyme. People that are using this also are doing other types of treatments, like being on antibiotics at the same time, and maybe even hydrogen peroxide, for instance. So it's hard to say when people say they're getting better with this, is it because of this or not? And frankly, we just don't have any good research on it at all. So I'm not using it in my practice. I'm not clear if it's something I will use in my practice yet. I'm trying to gather some information about it. I know some of my colleagues are using it though. Okay. All right. Thanks for that question. Good luck to you. Hello, Marcia. Let's see. Is it true that oxygen is bad for Bartonella? I had an ozone treatment and have been sick for weeks. So, I haven't seen people just giving oxygen itself. I haven't seen people necessarily get worse. I personally am not a big believer in ozone treatment. I think many of you know that from listening on my webinars. I know that in a petri dish or in test tubes, ozone can kill germs. I acknowledge that. Yes, it could be a germ killer. However, when you take those test tubes and you put them full of germs and you put just a small part of blood into that test tube, the ozone no longer kills anything. Okay, and the reason that ozone no longer kills anything is our blood is full of antioxidants that neutralize it. Okay, so I know that there are a bunch of people that claim benefit. There are a lot of practitioners now are trying to use ozone in their practices, but I think in the end it's a fad, and I think eventually it will go away. The thing that people do get benefit from ozone is it does result in better oxygenation of your mitochondria, according to studies, and that makes the mitochondria generate energy better. So people sometimes at first can feel better. However, keep in mind, ozone is an oxidizing agent. An oxidizing agent can damage tissues, cell membranes, and it may be that you're doing worse just from that. It could be, anyhow, I would be hard for me to say fully why you're doing worse, but I just to say, basically, I'm just not a big believer in it. Okay. Let me show you my article on it. So those of you that want to see why it is I'm against it and the science behind my rationale, let me go ahead and show you that article here. All right. So take a look at my article called, excuse me, Ozone, Hydrogen Peroxide, Vitamin C, UV Blood Irradiation, and Lyme. And in here, I lay out the science that calls into question whether this actually is a good germ killer. Okay? All right. Good luck to you, Marcia. Hello, Isa. Let's see. Hi, Dr. Ross. My friend Chris has been taking Hutania, Cascala, Toba, and Sidacuda for a few months. He has had to increase slowly. He is up to 4 drops of each twice a day. We know it's unlikely he'll be able to get up to your suggested 30 drops, and are trying to figure out how we will know when he's reached his maximum dose. Are there side effects of these tinctures that you see when a patient reaches their maximum? Should he just try to keep the Herx response within the not feeling more than 50% crappier window? Also, you had suggested a thorn fractionated pectin to boost Chris's butyrate levels, but it seems to be discontinued. We're wondering if it's worth spending a lot on a bottle or two, if he will then need to stop taking it, or if there's an alternative such as taking butyrate supplements. Also wanted to report that before he started his current dose, he had about 10 days of increased energy. Even food tasted different to him. Hopefully the same thing will happen again once his body gets used to this level, fingers crossed. Okay, so in terms of trying to find the level that Chris can tolerate, or anyone can tolerate, basically, if you go up on a dose and it makes you feel worse, and over the course of a week or two that doesn't lift, that probably is your top dose. Okay, so yes, it is kind of your 50% crappier rule here, basically. Okay, all right. In terms of oh, okay, I know. So the fractionated pectin powder, the reason I was having it use that is it's a soluble fiber that is useful at promoting healthy bacteria in the intestines that then manufacture their own butyrate, that then is, which is a good fuel source for your colonocytes, the cells in your large intestines. Okay, so it is actually still being manufactured. I'm not having any difficulty getting it at my store, and so you may want to take a look there. Okay, all right. Anyhow, those are my thoughts. Thanks for my question. Good luck to both you and Chris. Okay. All right. All right, everyone. I'm pooped. I'm tiring out as the day goes on. I know I've got another 7 minutes to do this, but I think I'm just going to call it quits here for today. I've had a long clinic day here, and every now and then I just doing these webinars kind of wears me out too. So I'm glad I was able to spend as much time as I did with you tonight. For those of you that are interested in doing this again, tomorrow when I send out my email, you're going to see in there a link to sign up for the next webinar, and that will be on April 30th. Okay, so I'm taking next week off. Take a look out in your email tomorrow morning, somewhere between 9:30 in the morning. I should have the email go out announcing that the video has been edited for tonight and that it's ready for you to watch. Okay, all right. Good luck to nice visiting with everyone tonight, and everyone, good luck to you. And especially avoiding the COVID-19 and on your journey of Lyme recovery as well. Okay, good night.